Coming to memory, memory is the ability to recall the past events at the conscious or unconscious level. It is the relatively permanent storage form of learned information. They can be either declarative or non declarative. Declarative, explicit, or recognition memory. It is associated with consciousness or at least awareness. It is dependent on the hippocampus and other parts of the medial temporal lobes of the brain for its retention. Explicit memory is divided into memory of events, that is also called as episodic memory, and also memory of words, rules, and language. So that is called as semantic memory. Coming to non-declarative or implicit or reflexive memory. Memory does not involve awareness here. Its retention does not involve processing in the hippocampus in most instances, and it includes skills, habits, conditioned reflexes. Explicit memory and many forms of implicit memory involve short-term memory and long-term memory. Short-term memory in which it lasts for seconds to hours, during which the processing in the hippocampus and elsewhere lays down long-term changes in the synaptic strength, whereas long-term memory, which stores the memories for years and sometimes for life. During short-term memory traces are subject to disruption by trauma and various drugs, whereas long-term memory traces are remarkably resistant to disruption. Mechanism of the memory, that is the cellular basis. Studies of memory retention and disruption of memory have revealed that both explicit and implicit memory are stored in stages by different mechanisms. Input to the brain is processed into short-term memory before it is transmitted through one or more stages, that is intermediate or long-term memory, into more permanent long-term storage. Mechanism of implicit memory. Mechanism of short-term storage of implicit memory. The various mechanisms for simple forms of learning results from the changes in the effectiveness of synaptic transmission, and it includes habituation and sensitization. Whereas mechanism of long-term storage of implicit memory, it is the process by which the transient short-term memory is converted into stable long-term memory is called as consolidation. Consolidation of long-term implicit memory for simple forms of learning involves three processes. That is, it involves gene expression, it involves new protein formation, and it involves the growth of the synaptic connections. Much information is transferred between two hemispheres through the corpus callosum, although some is transmitted through the other commissure, for example, anterior commissure or hippocampal commissure. Coming to some of the applied aspects related to the memory and learning is Alzheimer's disease. It is characterized by progressive loss of memory and cognitive function in the middle-aged individuals. Thus, the condition is frequently associated with memory failure for recent events, lack of spontaneous activity and initiative with loss of intellectual functions, and there will be extrapyramidal and akinetic hypertonic symptoms and loss of spatial orientation. After 2 to 3 years, dementia, that is memory loss, becomes well established and focal symptoms occur such as aphasia, that is speech disorder, apraxia, that is inability to perform voluntary movements, and agnosia, that is inability to recognize objects in spite of intact sensory modality. Similar features in the old age, that is around 65 years, are called senile dementia. Both the conditions are caused by the degeneration of the cholinergic nerve terminals in the cerebral cortex